You know, part of what we're focused on around the country is making sure that Latinos have a chance to reach their full potential in this country as huge contributors to the diversity and the broad richness of the United States. The Latino population has about 10.2 million nationally eligible and uninsured residents here in across the country. It's one of the highest uninsured populations in America, so outreach into the community to talk about what is available and what's coming is hugely important.
Our city's public health team, under the extraordinary leadership of Dr. Don Schwartz, has been working hard to make Philadelphia ready for open enrollment starting October 1st. So here are a few details. We have a healthcare reform link on the city's health department website, a frequently updated information resource on the Affordable Care Act exchanges. We have benefits counselors in our city health centers already, but now we are working to train them to help Philadelphians to get ready for exchange enrollment. We are working to train the various home health visitors in the city about enrollment and to give them information about exchanges to help connect their home health patients to insurance. And we'll be coordinating with the new navigators, the Affordable Care Act community outreach organizations, once they get up and running. And I want to point out that the city's health clinics are not eligible for navigator funding under the Affordable Care Act, but the City of Philadelphia, we're putting our own resources into getting our patients connected to those navigators.
So important to have partners like Congreso here in Philadelphia. And I don't think a website will necessarily change hearts and minds. It might provide information, but as you say, they say, well, I don't need that, that's not for me, I'm not interested. Neighbors, talking to neighbors, family members talking to family members. We think mothers can do a great job with their young adult children, saying, get smart, you need to take care of yourself, you need to take care of your family. So those conversations, trusted neighborhood organizations will be acting as navigators, having individuals who actually do town hall meetings and outreach meetings in churches and in neighborhoods. There even be some efforts going door to door and giving people information. So that's really what is going to be, I think, the most effective way to convince people that health insurance is important. It can really give them some security. It can make sure that they don't lose everything if they get sick, and that they can take care of themselves on a regular basis.
52% of the patients in Philadelphia health clinics are uninsured, and many live below the poverty line, and that certainly also pertains to our children here in the city as well. Unfortunately, the Commonwealth of Pennsylvania has refused to expand Medicaid, leaving many of our fellow citizens ineligible for any of the services under the Affordable Care Act.
If the governor and the state legislature don't expand the Medicaid program, we will have a number of low-income Latinos who really don't have an opportunity to afford health insurance. People who are below 100% of poverty, which means that they earn about $13,000 a year or less, would qualify for the expanded Medicaid program, and they would have very, very low-cost comprehensive coverage. But the state has to vote to do that, and so far the Pennsylvania Senate has passed Medicaid expansion, but the House did not pass it.